Neonatal Nursing by Maribel Franco, Mayra Barajas, Elizabeth Miranda Saldana, and Mireya Garcia. Today we will be talking about neonatal nursing, which is a specialized field within nursing that focuses on the care of newborn babies. Neonatal nurses work with infants during the first 28 days of life, and many of these babies require extra medical attention. This includes premature infants, babies with low birth weight, and newborns with conditions such as infections, birth defects, or cardiac and respiratory problems. In this role, neonatal nurses provide continuous monitoring and highly specialized care. They use equipment like ventilators, incubators, feeding tubes, and a variety of monitoring devices to support each baby's needs. They also work closely with doctors, respiratory therapists, and other healthcare professionals to ensure every infant receives the best possible care. A big part of the job involves supporting families. Parents of medically fragile newborns often experience fear and uncertainty, and neonatal nurses play an important role in explaining the baby's condition, guiding families through the care process, and offering emotional support during a very challenging time. The philosophy of neonatal nursing centers on caring and advocating for vulnerable newborns and their families, with a unique focus on developmental care and family-centered care. The core goals for neonatal nursing is caring for vulnerable newborn infants and to provide attentive care to directly impact the long-term health and developmental outcomes of premature babies or infants with medical complications. The patient population in neonatal care includes newborn infants from birth up to 28 days of life, especially those who require specialized medical attention. This group often includes premature infants, low birth weight infants, infants with congenital abnormalities, newborns with respiratory or cardiac complications, babies with infection or sepsis, infants affected by maternal or delivery related complications. Overall, the patient population in neonatal care is medically fragile and requires constant assessments, advanced technical skills, and compassionate support. Neonatal nurses play a crucial role in giving these infants the strongest possible start in life.
Hello everyone, my name is Mayra Barajas, and for this slide I will be talking about neonatal nurses work settings. So neonatal nurses actually have different work settings. They can work in hospitals, clinics, delivery rooms, and home visits. Neonatal nurses who work in hospitals, specifically in the NICU department, which is an intensive care unit for ill newborn babies. Neonatal nurses also work in follow-up clinics to give care to the babies once they are discharged from the hospital and delivery rooms. They also do home visits as well. During home visits, they come in and do a follow-up with the baby and see how they are doing after leaving the hospital. Neonatal nurses also assist the mothers with support if needed. For example, if the mom is a first-time mother, they will give her the resources that are needed to help her during postpartum and as the baby grows. There are also some nurses that work as transport neonatal nurses, which is when they are transporting critically ill newborn patients from one hospital to another or from a hospital to a follow up clinic. The day in the life of a neonatal nurse can change from day to day, but for the most part, the nurse will typically arrive and get a report from the previous nurse, and they'll look at the patient's chart for updates, medications needed, when their medications were given, when the last head to toe assessment was taken, when their vitals were taken, if there's any new doctor's orders or notes since the previous time they were there. They have to check their feeding schedule and make sure that the babies are being fed every 3 hours. Then they would typically do another head to toe assessment, take their vitals, change their diapers, feed the babies, make sure any medication is needed, then to administer that medication. And you want to make sure that you are documenting this, so they do take time to document. And then as another 3 hours pass, estimately, they do another round of vitals, they feed the baby once again, they do a diaper change, they give them the meds that are required, they take a lunch, and they do they give parents tips or assist them if, for example, assist them doing the babies can be skin to skin with the parents, and they're also making sure that they are changing the baby's positions. And at the end of their shift, make sure to give the report of the day to the new nurse that is coming for like the night shift or day shift, vice versa.
Emotional intelligence is something that helps nurses thrive within the neonatal nursing specialty. It helps them deal with stressful situations, problem solve, and develop relationships with peers and parents. Another thing to note is that neonatal nurses are caring for patients who are still developing, versus when caring for adults, patients are fully developed and often have more complex conditions. Caring for babies requires nurses to learn how to comfort not only the baby, but also the parents. This specialty has its upsides and downsides. A few examples of its joys would be being able to help babies while they're in a vulnerable condition, being their advocate, and creating close bonds with the baby and their families. A downside would be having ethical dilemmas, such as figuring out if treatment should be continued, and this is where education and training is essential. As a neonatal nurse, faith and values could also have a positive impact on how you care for the baby and their families, and how you are able to handle difficult situations. Families could find comfort in prayer, nurses might find comfort in a devotion or prayer before going into their shift, and knowing that they are caring for the patient with the strength of their faith.
In the United States, the average income for a neonatal nurse is 127,391 per year. The lowest income can range from 32,500 to the highest being 196,500. The income depends on each state and how much their hourly pay is. In California, the average salary is 125,723, which is pretty close to the average country income. So as you can see in the graph or the map for the nurse salary in the United States, this was just updated, if I'm not wrong, in October of this year. And one of the lowest states salaries is Florida, which is surprising because it is such a big state with the high population that you would expect their salary to be higher compared to the highest, one of the highest salaries, which is Washington. Washington has one of the highest salaries in the country. And back to the salary in California, their top earners are 180,603 compared to the top earners in the country is 183,000. So the difference is about a $600. And their top, as you can see in the bottom right, the top 10 highest paying cities are shown for the neonatal nurse jobs in California. And honestly, I'm not surprised because these are all cities surrounding the Bay Area or in the Bay Area. And the Bay Area typically does have a higher paying range compared to other cities.
Working within the NICU department, or just with babies in general, requires special skills and knowledge. A nurse must have great assessment skills because the health of babies in the NICU can change very quickly. Another essential skill is critical thinking because babies can't verbalize what they feel, so nurses must be able to pick up on subtle changes. Working as a neonatal nurse is also very family centered. Nurses working within the specialty many times have to teach mothers how to breastfeed, diaper, and bathe their new baby. Some soft skills or personality traits that would help nurses thrive in the specialty include compassion, patience, and the ability to keep composure in stressful situations. AMN Healthcare describes it perfectly. They state that the neonatal nurses must possess clinical skills to provide intensive care for the tiniest babies, communication skills to care for families, and passion for their profession.
In order for one to become a NICU nurse, one has to graduate with their ADN or BSN, but some employers do require a bachelor's to be a neonatal nurse. You have to pass the NCLEX and receive your state license because some states do have different licensing requirements, so it's good to find their state's application process. Some employers also will hire new hires for NICU positions, but some require a year of previous experience. Once they have been working for at least a year, they can apply for further certification beyond their degree and license. And some of those are NCC certification in maternal newborn nursing, NCC credential in inpatient obstetric nursing, RNC certification for neonatal intensive care nursing, and RNC certification in low risk neonatal intensive care nursing. A NICU nurse can continue their education and get their master's and doctorate. Also, they can continue on and become a nurse practitioner for pediatrics or pediatric mental health specialist. And those are only a few of a different career paths that one can extend to do. Being in the specialty comes with its rewards and challenges. Like NICU nurses get to celebrate their patients' growth every day, their new milestones, and preparation to go home, helping caregivers be ready and prepared for a baby at home. There are many opportunities for career growth and getting lots of respect because being a NICU nurse, you tend to have a combination of skills from technical skills to empathy and compassion. There's also a higher salary in the specialty, you're never on a routine, and it is in high demand. But there is also a lot of critical thinking and advocating for your patient. These patients do not speak for themselves, so when being a NICU nurse, they need to advocate for them. Some patients may not be progressing well and don't get to go home, so the nurses have to be there to support families through loss, be their comfort in difficult situations like ethical dilemmas where the nurse has to deal with a difficult situation that may arise and parents insist on everything being done for their child, but ethically, the patient's quality of life will not be good in the long run. Also, dealing with hostile parents or non involved parents can be emotionally taxing and is a very high pressure environment. Overall, there are rewards and challenges in this area, but it helps one to grow more as a nurse and being able to have better knowledge of infants and preemies and many opportunities for career advancement and knowing how to really have sympathy and communication skills with their patients' caregivers.
In conclusion, neonatal nursing is a highly specialized field defined by its focus on caring for newborns who are fragile, premature, or facing serious medical challenges. What truly sets this specialty apart is the combination of advanced clinical skills and the deep emotional support provided to both infants and their families. Ultimately, neonatal nursing is more than a job, it's a calling. It's about standing at the very beginning of someone's life and making a profound difference. Neonatal nurses carry a unique identity and purpose to protect, support, and nurture the tiniest and most vulnerable among us. And this is what makes this field so meaningful and deeply inspiring. Thank you.